in this podcast, we are going to talk about passive stretching. There's lots of information and opinions on the topic of stretching out there, and lots of different techniques available. So most people are either going to use passive or active stretching. They're the simplest forms of stretching. There are lots of other types of techniques. In level 4, we teach something called muscle energy technique, METs, but also you can have things like proprioceptive neuromuscular facilitation, PNF, most people know that as, active isolated stretch, AIS. So these are all requiring other people to be involved in them, but active and passive stretching you can actually do yourself.
So the aim of any stretch is to increase the length of the muscle being stretched by taking it past its normal range of movement. So this will then allow better flexibility and range of movement at that joint. So all the methods that Tamsin mentioned will achieve this. Now, active stretching is when you contract one muscle to stretch the opposite number. So an example of this perhaps is when you stretch your calf. If you pull your toes up, activating the tibialis anterior muscle on the front of the lower limb, for this to happen, hopefully from your muscle anatomy you can remember, the opposite muscle is the gastrocnemius and will have to relax or let go. That then means you're able to stretch it past its normal range. So in essence, you contract the agonist in order to stretch the antagonist. Now, in contrast, passive stretching is when another body part or external support is used to do the stretch. So this can be done by holding your own leg to stretch your quadriceps, or having help from another person to move the joint, or perhaps using a towel to facilitate a hamstring stretch. Any of those where you are not contracting the muscles will be a passive stretch.
Excellent. So that's your passive and active stretches. You can now subdivide these stretches into maintenance and developmental. And as you've probably guessed from their names, you can work out what they are. So maintenance stretching is to maintain the same muscle length as you already have. So this is something that you might do after exercise to maintain your muscle length. Developmental stretching, on the other hand, is to actually try and increase the length of the muscle. And this one will actually take much more work. And in truth, you need to be doing this daily. So you may be looking at things like Pilates or yoga if you want to do developmental stretching. But what we're going to be doing mostly within clinic is passive maintenance stretching.
So how are you going to do these? Maintenance stretches are generally undertaken as a mild stretch and held for 10 to 15 seconds, whereas developmental stretches are taken to the point of stretch and then as it eases, taken a little bit further. Now these are typically going to be held for 30 to 60 seconds, as already mentioned, need to be done daily. Stretches can be given to your client as part of the rehab plan, but make sure you go through them carefully and consider all the teaching points, such as alignment of the joint first. Don't leave people on their own and just say, off you go and stretch your quadriceps. They won't A, know how to do it necessarily, and B, necessarily do it correctly.
The other thing you can do for them as well is take photos of them doing the stretch in the correct position and make notes that they can take with them so that they get it 100% right, because people won't do it if you don't give them the best advice. And I hear that actually a lot, where people have been to physios and they said, you've given me all these exercises, but I haven't done any of them.
Yeah.
So good guidance is important.
So passive stretches are best used at the end of a maintenance or a post-event massage. So once you've warmed up the muscles, it's going to be much, much easier to get a nice stretch and you're less likely to injure a cold muscle. So personally, I wouldn't recommend passive stretching at a pre or intra-event massage, as dynamic stretches are generally better and more effective here.
Excellent. When carrying out a passive stretch on a client, it is really important to have good communication skills with them. You need to talk to your client all the way through the stretch. It's recommended you get the client to do a few active stretches before starting the passive stretch. The easiest area to carry out stretches are on limbs and the neck. However, it is possible to do stretches on the torso, and we will show you a few of those in the videos. But they tend to be a bit more of a cross between a passive and active stretch.
Yeah, you often need some client assistance
to
get them done. So before we demonstrate the stretches, the things you need to go through with your client beforehand are going to be really important. So firstly, explain the stretch to your client, what they should expect to feel to let you know if there's any unusual or unpleasant sensations. So also let them know how long you intend to hold the stretch for. There's nothing worse than somebody being sat there thinking you're trying to pull their leg off for the next 60 seconds because they don't know what it's meant to feel like. So you can also raise sort of any key points that you can't control. So like keeping your bum on the couch, not to lift off your back, and sort of let you know if there's any sort of other feelings of pulling or discomfort is really, really important. Also, letting them know not to try and increase the stretch and help with it. If you're doing a passive stretch, the last thing you want is somebody actually trying to do it for you. It actually doesn't work very well.
Okay, so once you've done this, once you've talked through this, go and you go into your stretch. Ask how it feels and keep a close eye on the alignment for your client, because they will do things like lift their bum even if you've told them not to. When you get to the point of stretch, you need to hold it there, and what I always do is count through the last few seconds just out loud, so my client just knows where I am, and all of a sudden I'm trying to let go of their leg and they start to resist because they don't really know what's going on. So what we've done is we've created a collection of videos for you, so have a look through those. We've covered most areas, I think.
Yep, covered most areas in the stretching video, just as some ideas of how you can stretch different areas. Obviously you can create and adapt your own, add any in, but what we've hopefully done is give you a sort of comprehensive guide of a few different ways to stretch different areas of the key major muscle groups that we find most commonly need stretching.
And a few of the more difficult ones as well. So go and have a look at the videos and then have a go at them on some models and see how you get on with them.
Perfect.